This is our October meeting, Utah Children's Care Coordination Network. And here's what we're going to do today. Yep, maybe there we go. So we'll do our normal welcome and introductions. We really like to take a few minutes at the beginning of every meeting and go through and let folks introduce themselves. You can do that either via the chat and we'll read that out, or you're welcome to unmute and go ahead and talk. We love that too. One real goal of the UCCCN is to provide a networking opportunity. And so the best way to be able to network with your peers is to know who they are. So we'd love you to tell us who you are and what your role is and where you work. And then we'll take a few minutes for announcements and some updates on the medical home portal. Then we have our favorite time, my favorite time, which is when we talk about cases, QI projects, anything else that's going on in your practice with your own efforts to be the best in your role that you can, whether that's running up against barriers and hurdles that you want to share with us and maybe get some input on. If you'd like to give us an update on what's going on with your previous case that you mentioned, we love hearing those as well. So all of that would be terrific. We would love you to take that time. It's your time. And again, if you want to use the chat for that, that's great too. And we'll read that out for you. Then we're going to have a summary of the 4th annual Transition to Adult Healthcare Summit, which took place last Wednesday. We're hopeful that many of you were able to attend that. There was a virtual as well as an in-person option there. And those of us who were physically at the meeting couldn't necessarily tell who was on the call, but we'll go ahead and we'll try and bring you up to speed with what happened there. It was a great meeting as always, and we want to try and impart some of what we learned to you. And then we'll wrap up by 10. All right, so let's start with those welcome and introductions. And I always just take a look at the participant list and read that down. So if someone pops on a little bit later, I hope I can find them again. But here we go. So I'm Mindy Tueller. I am the Director of Operations for the Medical Home Portal. You can see a lot of our logos along the top here. I also facilitate this meeting, which has been going on now for, I think, something like 8 years. And we're very delighted to have the support of these other groups as well for UCCCN. Michelle, do you want to introduce yourself next?
Yes, good morning. I'm Michelle Redfield. I am the Administrative Assistant for the Medical Home Portal, UCCCN, and the Division of General Pediatrics.
Yeah, Michelle keeps everything running. All right, and then Monica Wimberly, are you able to introduce yourself? Got a chat? Great. Monica is a new nurse care manager at the Sugar House Clinic with the University of Utah, and her teams cover all of the primary care providers, and she'll be taking care of most of the pediatric patients. She doesn't have a microphone. No problem at all, Monica, and welcome. We're really pleased that you're with us. Fabulous. Okay, Amy Boyd.
Hi, guys. Can you guys hear me okay?
Yep.
Okay. My name is Amy. I am a QI specialist with the U of U Department of Pediatrics, and I am over the Aspire project. So I am working with an autism research group and trying to improve outcomes with autistic kiddos.
Fabulous. We're so happy you're part of the team, Amy. All right, next I have another Amy Nance.
Good morning. I'm Amy Nance. I am the Office Director for Children with Special Healthcare Needs here at the Department of Health and Human Services. And we collaborate with Mindy on this project with our Title V dollars. So thank you.
And we're so happy that you're able to join us on most of these, Amy. Next is Ashley Donham.
Hi all, my name is Ashley Dunham and I work for the Department of Health and Human Services, Office of Substance Use and Mental Health, and my specific position focuses on intellectual and developmental disabilities and mental health services.
Yeah, we're really grateful that you're taking the time to attend these. We really appreciate that, Ashley. And Athena.
Hi, I'm Athena Parker. I'm with the Medical Home Portal team and I work as the Support Services Manager.
Terrific. All right, and Daniela Ramirez.
Hi, I'm Daniela. I work in care management at the University Pediatrics Clinic. I do a lot of care coordination and care management type stuff.
That's fantastic, Daniela. And so University Pediatrics Clinic is in the hospital.
Yes.
Right. Okay, terrific. Thank you. So glad you're here. All right. Hey, Dora.
Good morning, everybody. My name is Dora. I am the Professional Relations Coordinator for Shriners Children in Salt Lake, and I assist with any provider or case manager that needs assistance to refer at Shriners. And just let you know, if your contact was Jill Connor, she is no longer at Shriners. So I'm going to put my contact information on the chat, and please save my information and contact me at any time if you need anything.
Yeah, we'll miss Jill, but Dora is fantastic. And if you need to be able to contact her and you don't have her information, just let me know. And Dora's going to speak with us in a few minutes with an update as well.
Thank you.
All right. Eric Stoker.
Thanks, Mindy. So good morning, everybody. My name is Eric Stoker, and I'm the Information Specialist for the Utah Developmental Disabilities Council. And my passion is about, transition. And Mindy invited me to this meeting to talk about transition and share my experiences of how it went as a person with a disability.
We're so glad you're with us, Eric. Fantastic. All right. Gwen.
Sorry, I was having trouble finding the mute. My name's Gwen. I'm part of Eric Christensen's integrated services team. I cover Carbon, Emery, and Grand counties. And I'm not sure if there were other directions because I just barely hopped on.
Well, that's it. Oops. Sorry. I'm moving ahead on there we go. Yeah, you're fine, Gwen. No worries. Perfect. All right. And Heather Carlson.
Thanks, Mindy. Good morning. I'm Heather Carlson. I'm a nurse care coordinator for Eric Christensen's team, which is part of the integrated services program. And I'm located up in Davis County, Northern Utah area.
Excellent. All right. Welcome, welcome. And Heidi Bates.
Hey, I'm Heidi Bates. I'm with UPIC, QI Specialist.
Excellent. Glad you're with us this morning, Heidi. And Julie Southwick.
Hi, I'm Julie Southwick. I am with Eric's team as well. I'm a transition specialist and also a health educator with the Utah Birth Defect Network.
Welcome, Julie. We're glad you're with us this morning. And next is Laurie Gould. Oh, she's in the chat. Okay. She is a new Med Home Coordinator with Salt Lake Wasatch Peds. Fantastic. Oh, we're so glad you could join us. We really love when Wasatch Peds is able to have folks attend. We know that can be tough. So welcome. And if I'm saying it wrong, sometimes it's Lori or sometimes it's Laurie. So I apologize if I got that wrong. Okay, good. Oh, okay. And Nadine Ashley.
And she has hers in the chat. Nadine Ashley is a RN care manager at the U Health Clinic in Sugar House.
Thank you very much, Michelle. Great. All right, Natalie Allen.
Thanks, Mindy. I am a nurse practitioner and I work for the Department of Health and Human Services Integrated Services Program, Eric's team, and I work with all the care coordinators across the state. So anyway, always glad to be here.
Wonderful. Yeah, we're always glad to have you. Patricia Brown, and I think you put your information in the chat, so I'll just read that quickly. It's Patty Brown, and Patty's with Monica and Nadine, nurse care managers at the Sugar House Clinic, and no audio or video on their computers right now. Hopefully that's just on your end. Hopefully you're seeing and hearing us. All right, and next, Chanel.
Hi, I'm Chanel Ekman, and I am the Senior Technology Specialist for the Medical Home Portal. So I just kind of handle everything technology related.
We're glad you're with us, Chanel. All right. And I see Tani Dunn next in the list, and she put her information in the chat. Tani is a nurse at Northern Utah Pediatrics Ogden location. She works with 2 other nurses in the clinic. It's a new role. So doing what you can to help make the nurse role in the clinic. And that's wonderful. Okay. You're in and out. We understand. No problem, Tani. Glad you could be here. All right, Tina.
Hi, I'm Tina Purcells. I'm with the Medical Home Portal team. I author and review the pages on the portal. I'm also a parent of a young man who is 22 and fabulous. He has multiple disabilities. And then I also am the one of the parent consultants for Utah Family Voices at the Utah Parent Center.
Tina wears a lot of hats, and she's a terrific resource. We really are glad you're part of these meetings, Tina. Thank you. And Walt.
Good morning. I'm Walt, part of Eric and Amy's group, and part of also of Integrated Services Program, part of the state health department. And I'm a care coordinator in the Salt Lake office.
Terrific. So glad you're with us this morning. And Eric Christensen, the Eric that's being referenced a lot.
Yes, well, the other Eric on this call, and certainly not the best Eric on this call. We have Eric Stoker who's here, but I'm Eric Christensen, and I manage the Integrated Services Program with the Department of Health and Human Services. We've been really proud to partner with the Medical Home Portal and Mindy's team to sponsor the Utah Children's Care Coordination Network for the last several years. And we're just really delighted with that partnership and the ability to bring these monthly meetings to you and work with this incredible team. So delighted to be here this morning. And I'll be speaking with you in just a little bit.
Yep. Thanks, Eric. All right. Okay. So it sounds like everybody pretty much knows this, but doesn't always have the equipment to do it. But if you're able to be on a computer with audio and video, that seems like the best experience. But any way you can jump on these meetings, we're glad to have you. And we will do our very best to end promptly at 10 a.m. So some announcements, and actually before I show you the survey results, and maybe I can be queuing that up, I'll give a few minutes to Dora. So I'll stop sharing. Dora, do you mind talking a little bit about what's going on with Shriners Children's that you wanted to share?
Yes. Let me share here really quick. Oh yes, share screen on Zoom. Oops, I think I have to have it open first. One moment. I have so many screens open. Let's see. So we're always looking and for feedback in the clinics for how we can help you refer patients. And we've made a electronic fillable referral form. So you can just save it on your desktop. Let's see. All right, that should be up. Can you see the patient referral form?
Yes.
Perfect. So this is what it looks like. I'm making sure, I just noticed the referral, the email isn't on there, although it is in the instructions down here. So I know a lot of clinics like to have it in paper and fax it in, but if you want to just have it saved on your computer, just fill in patient's name, last name, everything, fill it out. And then the primary care provider, or if it's you, but we can just have everything there, type it in, email it to us, and then you don't have to worry about it. And then you can have it saved in your outbox or however you want to save it. Once that's fixed today, I'll have it mailed out to all the contacts I have in my email, and I have some for Jill. So that should make it easier for you. So you don't have to worry about paper and having it there. You can just always have it saved. Also, I'm going to have these printed on a tear pad. So if your clinic does like to do it through fax, you can still have that option. And I will be mailing those as well. So like I did mention, if you were a contact with Jill, I send my information, send me a quick email just to make sure I do have your email, but she did leave me her information as well. I just don't want, I want to make sure that we stay in contact. So that's pretty much it. It's pretty simple. Just a new way to, hopefully something that saves you a little bit of time and a way that you can save your own information as well. So does anybody have any questions?
Dora, I didn't see an email address there where to email that form. Maybe you could include that on the form so that we would always have it.
Yes, so I did notice that last night, and I sent that to our team to make sure that they add it up there. This is the back sheet with the instructions, and it has it right here. But I am going to, before I send it out, I am going to make sure that they add it right at the top, right up here. So I sent that in last night for them to fix. It should be a pretty quick fix. So I'll send this to Mindy, and she can send it to everyone on here as well.
Great.
That should be it. Did I stop sharing?
You did.
Yes. Okay.
Thank you very much, Dora. We'll get that sent out.
Okay. Thank you for your time.
Absolutely. All right. And so as I was mentioning, we wanted to show you the survey that we kept asking you to fill out. So thank you to for being patient with us with all those emails. But here is the results. It's really big. Is it too big? It's a little too big. So pretty interesting. I've only had a chance to look at these just this morning, and this will be new really for everyone. So we ended up having 39 people respond, which is pretty neat. Thanks to everyone who did that. And some very interesting information that really not the majority of respondents are required to hold a license to do their role. But those who are responded, and we saw some interesting licenses. So they include social work. They include a lot of folks have a nurse license of some sort. We have some certified health education specialists. And I think we had a recreational therapist, which is pretty cool as well. So even though the majority don't need continuing education credits, we did see that there is a desire to have some of those come through UCCCN. So 28 of our respondents versus 11 said that would provide value. And also professional development credit, which is a little bit different. It's more of a, it's less of a process that we would need to go through. But I think that it seems like it's worthwhile. We've got 29 responding that would be helpful. So that's pretty cool. We will take that information and move forward and see what we can do about both of those things, and we will report back. And then we also asked a slightly different question, but we wanted to find out if there would be a platform, a different way to allow folks to connect in between meetings. We have our email listserv that is very available, but it's, it's email and it's not super visual. And we wondered if a private Facebook group, Facebook, you might love it, you might hate, hate it, but the private Facebook groups I think are a little bit different, and they've been around for a long time, and they can be moderated and all of that. And so it seemed like maybe we could jump on those without too much of a learning curve, potentially. It does mean that you need to have a Facebook account. So that's the one downside, but perhaps it would be a Facebook account that you'd never use for anything other than this. So based on the responses, it looks like we're going to go ahead and give that a try. So watch for that in the coming weeks. And I'm pretty excited about this. And again, thank you so much to everybody who responded. We really appreciate that. It's so helpful to get your feedback. This is for you. So we need to know what you need. So thank you. And we'll try not to pester you so much. All right. Oh, we did that already. Okay. All right. As usual, we want to remind you about the Spark Autism Study and the fact that the University of Utah is one of not too many of these national locations for this research study, which is pretty cool, very easy, and ultimately going to provide a lot of important information with regard to autism, and will allow the families who participate to potentially get some important individual information, as well as some Amazon gift cards, and they can do it all.
And Mindy, can I just kind of make a little about Spark?
Yeah.
So this is Heidi with UPIC. And also, just so we are now one of the very few sites, I think we're the only third site that's offering Spark in Spanish. So before it was only those that could read written English and understand the English. Now it is offered to those who are Spanish speaking.
That's important.
Okay. Yeah, I'm going to get they're mailing out some brochures. I'm going to get that and get it going. Also, just when they register, parents, this is just not just like a genetic, this is not just to help with autism. There's webinars, there's newsletters. Last month, they did this webinar on adolescents that, when they hit puberty, kids that have autism and they hit puberty, what to do. So it's not just a research study. There is some really good webinars and videos and newsletters and anything else you can think of. It is an autism community.
Excellent. Yeah, I was just looking more closely at this slide, and it says a growing community, and it sounds like it really is. So that's great. Thanks, Heidi. Excellent. So yeah, don't forget that this can now be something that your Spanish-speaking families can take advantage of. That's great. Very, very good. All right. So just a couple of updates on new content on the Medical Home Portal that might be very interesting to you. We're really trying to do more with these care pathways, AKA algorithms, care process models, that sort of a thing. So here is the latest one that we've added in our guidelines and algorithms section. And just wanted to make you aware of this. So it's a newborn palliative care algorithm. And this comes out of the Well Baby Nursery at the University of Utah. But that certainly doesn't mean that it might not be of value to, someone somewhere else. So this may not be something that you'll utilize yourselves, but we just want to make you aware that this is something that we're trying to continue to add on a regular basis, is information on how to do things with these guidelines. So if this, then this kind of a thing. It really helps take the guesswork out of stuff. So very important. And then let me pop over to this one as well and just show you our updated bullying page. So this may be something that's very useful to you. So we've just had an update on this content page. And I think the information is much more fleshed out and up to date. And we've got cyberbullying information in there now as well. So I wanted to make you aware of that. Okay, so let's start talking a little bit more now about transition. October is our transition month for sure. And well, honestly, this has been the year of transition, but particularly this month. And so when I was at the Transition Summit last week, I sat next to someone who works with Intermountain, and she talked with me again about the Living Well program. And I was like, wait a second, I do know about that, but we haven't talked about that for a while. So I'm just going to look it up for you really quickly here and show you what the Living Well program is. It's definitely more for those who are adults, But that's what we're wanting, right? We're wanting children and youth to transition into that adult world. And there's just a series of opportunities here, workshops, health education, that sort of a thing. And let's look at English workshops for a moment, but you can do it by condition. And again, some of these are going to be certainly focused on the elderly or with conditions that aren't going to be as specific as what we see with our young people. However, that doesn't mean that there aren't some very interesting opportunities here. So I just thought I would remind us that we've got some of these options that we should take advantage of. They're all free. So Tai Chi, that's pretty cool. Living well with chronic pain, living well with chronic conditions, living well in the community. These seemed like they were relevant, and I wanted to pass that along. And those will go out in our notes for sure. Okay, so Athena, can I turn the microphone over to you for a minute?
You can. All right, so on the topic of transition, I'll go ahead and highlight a few things that are happening with the transition content on the medical home portal. So right now I'm in the for families section in the transition to adulthood area, and I'm just going to highlight a few changes that you may see as you dive into this content. So with guardianship and estate planning, now you'll see some more information around supported decision making, and also within legal issues, you'll see that has been renamed guardianship and supported decision making as well. In addition, under timelines, tools and checklists, this used to just be called tools and checklists. We've added timelines, so there's a lot of more information in there now around timelines, which is helpful for families, providers, everyone to kind of start reviewing and thinking about at what ages certain things need to happen. And then in addition, on the transition to adulthood page, there is some information now linking back to some of the work the Utah Parent Center is doing with their Transition University workshop series, so that it links to that right here. And in addition to this information, up here at the top of our navigation, you can see we also have this tab called State Partner Projects. So in there, under Utah projects, we also have taken some time to highlight transition projects specific to Utah. So this is another place you can go to look at information specifically happening around transition in Utah. And if you're interested in what our other states are doing, you can also look at that as well. And then within our Utah directory, sorry, this will be the last thing. I just wanted to remind you about some ways you can search for service providers related to transition. So again, if you know the name of the agency, go ahead, you can put it in the term search. Another great way to look is through the categories. So if I just search the word transition here, it's going to bring up all of our categories related to transition. So you can see we've got adolescent healthcare, transition programs, education transition services, adult day programs, independent living, social, recreational, and supportive housing. And we're actually going to be adding a couple of categories. They're currently in review, but we're looking at adding adults protective services and adult respite services as well. So look for those coming. And then as we have this conversation today about the transition summit, we may find that we have some need for other categories to be added as well. So we're always open to that feedback. If you have something in mind that you think really needs to be added, we love to hear that as well. So.
Thanks, Athena. That's terrific. All right, I will share again. Okay. All right, so I wanted to mention again our pediatric Project ECHO transition presentations. We're going to have 4 in total this fall, and I'll show you the webpage where you can find all of that in just a moment. But I wanted to make you aware of the fact that we've already had 2, and we've got 2 more coming up. We have one on November 2nd and one, I can't remember the date of December, but it'll be, I think, the first Wednesday in December. But we're grateful that Eric Stoker is with us today. He actually is one of the reasons we now have supported decision-making information on the portal in a more robust fashion. He presented on that in our October 5th ECHO. And Eric, this is a perfect time for you to talk a little bit about that. And I'm going to go ahead and switch my screen and show that page where folks can find the link to the recording and also to your slides and all the slides from that October 5th. So do you want to talk?
Sure can, Mindy. So Mindy asked me to come and present to ECHO about supported decision-making, because sometimes when people with disabilities are getting to adulthood, they get nervous about making their own decisions. But when we talk about supported decision-making, we tell them, hey, this is not a rule or policy. It's a belief that you can make decisions, because we need self-advocates to make decisions at a time, because a lot of times the self-advocates get nervous about making decisions. We're like, let's work on this together. And it's an easier way to help them make decisions. And can we flip up some of the slides a little bit, Mindy?
Oh, yeah. Let's do it. Right here. Okay. Yep.
So if you look at the second slide right here, supported decision-making is sort of like guardianship, but it's an alternative though, because rather than a guardian making decisions for a self-advocate, it allows the supported decision-making allows the person with a disability to make their own decisions with support from a trusted team. And it also allows for changes as an individual's preferences, needs, and change. Because a lot of times self-advocates make a lot of different changes, because I make changes as well each and every day. And I'm like, what do I do?
Right.
And then we wanted to learn more about, and then during my presentation, I talked to a lot of the participants at ECHO saying the parent caregiver has to support the young adult and helps them and understands the situations and choices they face. And then they also teach them how to be independent in their communities, be a self-advocate, and learn more about self-determination. It allows the young adult to the dignity of risk. And it's also like the right to try and fail and succeed. Like if at first you don't succeed, just try again. And then they also support the self-advocate with a formal and informal resources, and it requires the young adult to sign a medical release for the provider to share their medical information with their parents and other caretakers. Because when I try to sign a medical release form, I just myself, what am I signing? Can you explain it in better terms? Because a lot of times when we do forms, it's so confusing.
Yeah.
And then also I talked about like the young adult's responsibility and supported decision making, like they had to be willing to accept responsibilities and consequences of the decisions they want to make, be willing to write down their ideas, be willing to try new ideas and explore different possibilities, and to look at their own strengths and challenges when to decide on the supports they'll need in order to be successful, work with a team of supporters to each of their goals, and then show people that with the help that they can make good decisions that will improve the quality of their life. And also we wanted them to learn more about self-determination and self-advocacy. And so that was a little bit about what we talked about in the ECHO presentation.
Yeah. And it was so well received. And I know that if anyone wants to understand a little bit more about self-advocacy and what Eric is doing, that you would be very happy to talk with them directly about that.
Yep.
Okay. Yeah, that's terrific. Let's see. There was something about, I think it's this self-advocate's guide to supported decision-making. That's a mouthful. And such a great resource, right?
Mm-hmm.
Wonderful. Well, yeah, Eric, we always appreciate when you join us and share your experiences with us. So thank you very much for coming on today and for being a resource for this community and for the state of Utah.
My pleasure. Glad to help.
Thanks.
I want to butt in for 1 second. Thanks,
okay.
Eric. I think this is cool. I'd love to get together and work with you and talk about what supported decision-making looks like for people who do have guardianship for a lot of reasons. So hit me up at work. I'd love to talk to you.
Will do.
See, it's all coming together. I love it. All right. And so this is a few more of our upcoming PEDS ECHO presentations. We have one later today on general headache management. And again, if you're unable to attend these, we record them and we get them posted pretty much the day after on that webpage that I just showed you. And we'll make sure that that link goes out in the notes. All right. What does ECHO stand for, Nadine? That is such a great question. And I never can remember. It's education and it's community health outreach, I believe. I think that's what it is. And it's, thank you, Jennifer, extension for community healthcare outcomes. Well, you know, I think I got one of those. It was started in at the University of New Mexico way back in 2003. And they came up with that acronym, and for better or worse, that's what we get. All right, well, I'm happy to say that this is your time to do some brainstorming, although we have eaten into our time quite a bit today. So I'll try and keep this fairly focused, pretty short. But is there anyone who'd like to bring up a case or share something with us?
I have something. This is Tina. It's not a case, but I know that we're going to probably, many of us will get flooded with questions about, is there help out there for Christmas? It is not, yeah, we've heard that some of the places have already shut, you know, they're at capacity. So I would love to maybe utilize our UCCCN group to, you know, if you know of something, if you have something, to send it to all of us so that we can pass out this information. I know Parent Center is going to be doing some giving trees. So I've got a few opportunities to get somebody onto those if necessary. But yeah, I think like the Salvation Armies and the, you know, your basic Christmas help is already pretty full.
Okay. Thank you for that heads up. And so we'll pass out that plea that if folks hear of resources to help families for Christmas, please pass them along to the whole group. We can use the listserv, or you can just let me know and I'll do that. Gwen, do you want to take a second?
Yes, I do. One for Christmas help down in my area, United Way is a great resource. So a lot of our families here use United Way. So I had an interesting call last Friday that kind of got me thinking a little bit. I had an EMT call me and say, hey, we've got just notified that we need to go and investigate a CPS abuse case. The child is hearing impaired, and we need a sign language interpreter. Now, I don't know every kid in our community that might be hearing impaired, but I know a few of them. And most of them really are not fluent in sign language. Later, it turned out and they can't tell me who the kiddo is, of course. Later, I found out who the kiddo is because the mom contacted me. But what I did is I just brainstormed everybody I knew that did some sign language interpreter. One was the deaf PIP coordinator for our area, who may or may not have even been in our area at this time. Another mom that I know who works in the school system and is a parent of a deaf child. But I got thinking, what if I didn't know anybody? You know, who could I reach out to, or is there a list? I'm not sure what they ended up doing. Mom did not say when she notified me, but I thought, you know, that would be really hard to find somebody to interview on short notice. So I don't know if anybody else has ideas, but I felt like, ooh, that was a tough one on the spur of the moment.
Are they not fluent because they rely on technology?
Oftentimes, and this might sound sort of implicit bias, families just are not fluent in sign language, and we don't have a community of a deaf community here. So most families that, like I know through early intervention, they might learn a few power signs, and then they do try to get like a cochlear implant or something later, but it's kind of a mixed bag whether they are successful with that too. So, and sometimes I don't know if maybe the EMT didn't know. And since I didn't know who the kiddo was until later, this kiddo does have a cochlear implant, but also they're Native American, and there's learning delays. So I don't think that they would have been very communicative anyway. But I just thought, gosh, I wouldn't even know who to, refer, except for people that I do know that, in the community. So I'm not sure how that happened. Nobody, mom reached out to me and told me that they had that happen, but other than that, like, no professionals have reached out. So I don't know, but I'm just like, that's kind of a hard one on the spur of the moment. I did think of a couple other people I could have referred to after, but it wasn't until after. So I don't know if there's a list or a way, that if that's something anybody else has ideas on.
Yeah, and because of time, I think we better not delve too far into that, but we will do some researching on our end. I know that translation services has come up in this forum before, so let us do some checking on that for you, Gwen, and I'll get back to you specifically, and we'll also put it in the meeting summary. I think that's really important and very interesting, so thank you. All right. Thank you. Thank you. All right, let's jump in now to our summary of the teen to adult healthcare transition summit. I would just be very curious if you guys could maybe put in the chat if you have a chance, and if that doesn't work, you're welcome to unmute and say it. But how many people actually attended? Natalie did. Oops. Tina was there. Julie was there for sure. That's right. All right, not getting any more. So it seems like this is going to be helpful then to the majority of folks here. So great. All right, we'll look forward to that. So this is the agenda that was for the meeting. It started around 7:30 and went till about close to noon. And so what we'll do is, if it's all right, Eric, I'll pop up Dr. Hergenroder's slides, and you can just tell me to scroll on through or stop, that kind of a thing. And you can do a quick summary of that very well done presentation around building a healthcare transition program. Does that sound okay?
Sorry, I can never find a mute button. You'd think this is my first rodeo. So yes, that works great. I appreciate that.
All right. Let me jump in here. Get up to the top, and we'll do that again. All right.
Okay, well, we had a really terrific turnout at the summit this year, and we were delighted to have Dr. Hergenroder come in and be our keynote speaker. He's worked on transition for a really long time. And as a keynote, he covered a lot of basics. And when Mindy and I were talking last night, kind of comparing notes and talking about this, we did conclude that he covered a lot of basics. And for some of us who've been doing transition for several years and have been working or attended these conferences for the last several years, we thought, well, was it useful to go over some of the basics again, or for some folks who have been attending for several years? And the conclusion was most definitely. For people who are new, the information was invaluable. For those of us who've been doing it for a while, it's always an excellent opportunity to go back and look at the basic things we should always be considering. I think sometimes, we talk about getting into the weeds sometimes, but I think sometimes it's important to get out of the weeds and go back and get back onto the trail again and say, what got us into the weeds in the first place? And so I think going back and looking at some of the basics and answering some of the questions and evaluating where we are and what we're doing is really important. And being a program manager at the Department of Health and Human Services and having an emphasis on a national performance measure for a federal block grant that really focuses on transition, I had a bit of a wake-up call to say, we need to go back as a program and look at some of these basic things. So some of the talk was to look at clinical service and how the whole process can be improved. So wherever we are in this process, there's always room for improvement. That's a huge takeaway for anyone. Whether you're just beginning or you've been doing it for years, there are always ways to improve. To look at a timeline for development, if you're just barely starting, no need to panic and say, we have to have this ready to go in 30 seconds. I think Dr. Hergenreuter said, it might take 5 years to really have something going. And then guess what? At 5 years, is it perfect? Probably not. So no panic if you are just barely getting going on this, and no reason to feel you have to have something perfect right out of the chute. I think at one point someone said to me that perfection is the enemy of progress. But sometimes we think we have to have everything perfect right out of the chute, and that is not the case. And that was a huge takeaway for me. And then to be constantly evaluating or looking at progress, implementation, and just where we're going and the direction. Mindy, let's look at the next slide. And I have it up on mine, but I cannot multitask and look at both. So I'm just going to look at what you have here. The initial discussion was, why did they get going on this in the first place? 2004. I know some of you on this call are youngsters, and I can say that because I turned 55 yesterday, so I'm eligible to live in those 55 plus communities for active seniors now. But in 2004, there was a lot of discussion on people being really frustrated with saying, it is hard to move some of our complex kids, some of our complex youth into adult practices. There's no means, method, way of doing this, and what do we need to look at? So they looked at what were some of the issues, and let's go to the next slide here, because I think this gets to the root of the issue. And this is just a question. I don't need responses on this, but how many of you folks have ever done a Venn diagram or a fishbone, as they call it? On where the head is that's the big problem, the big gist, the what's not going on. Flat out, transition wasn't occurring. People felt like they were throwing the pediatric practices felt like they were either one of two things: keeping their kids in the pediatric practice for time immemorial, or throwing their kids to the wolves because there was no one really taking them on. And with the Venn diagram or the fishbone, you are diagramming what the problems are, and then the main problems, which are basically the bones there, and then underneath that, all of what contributes to those sub problems. They came up with 6. Youth are unprepared. They don't know how to move to a new provider. Insurance is an issue, and back at that time, we didn't have Affordable Care Act protections up through age 26. Eric just said, from a personal experience, I was a little nervous transitioning from child doctor to an adult doctor. I wasn't sure what it would be like. And that fear of the unknown is huge, Eric. And I think that's part of it as well. Our youth just aren't prepared for that, and weren't prepared even more so back in the day. They don't know about insurance. Lack of adult providers who are prepared to take our youth. We had a meeting yesterday with adult providers who said, we'd love to take these kids, but when we have so many patients that are complex that we have to see, it is a huge amount of work to take a complex pediatric patient and spend the huge amount of time it takes to review thousands of pages of records sometimes when we don't get a terrific summary that comes in, and be prepared to see that patient. And then what happens if we spend all that time and the patient doesn't show up? So there are huge issues there. Parents don't want to leave. Heck, we've been bringing our baby boy or baby girl to this practice for 18, 19 years. We don't want to leave. This practice loves us. They take care of us. They nurture us. It's tough. There's no clear roadmap of how to move on to anywhere else. The services don't communicate. How does the pediatric practice communicate with the adult practice? Or do they? Or does that adult practice, are they ready to hear all the issues and concerns with that complex patient? And there's no tool to document. Sometimes getting that stuff across between EMRs The workflow is crazy. How do you cull down thousands of pages of a very complex patient's medical record with multiple specialists and primary care and get that into a concise document that a provider can read in just a few minutes and know the whole gist of what's going on with this complex patient? So, you know, in a nutshell, that just outlined the huge problem that existed and in many ways still exists, even with better technology, the Affordable Care Act, and a lot of work that's going on here locally. Still, many of those problems exist. Let's have that next slide. And that's what it looks like a lot of times, and that's what it feels like, but not quite that bad. That's just a gross hyperbole, if you will, of kind of what it feels like. Let's scan ahead just a couple more slides here, Mindy. I'm not going to go into this, but just step one, adopt a framework for building your plan. Talked about 1966. So folks, just point of interest, I've already told you how old I am. That's a year before I was born. Donabedian created a process that talked about structure, process, and outcomes as relating to medical, because he said, medical providers just want to go in, they want to diagnose something, they want to fix it. But as you look at something as complex as transition, you need to look at the structure in which it resides. You need to evaluate all of the processes involved, but then you also need to say, what is the outcome? And in this case, successfully transitioning an individual patient. We have to remember here, these are all individuals that are trying to function and thrive and survive within a very, very, very complex, multi-tiered system and multi-organizational system, all of which have different ins and outs and through points and all of the rest of it. But we have to say, what is that outcome? And that is the successful transition within a system. Let's look at that next slide. Quality improvement. Draw it out. How often do we sit down and draw things out? We get really caught up in the very bottom one, the PDSA cycle. And that is, oh my gosh, we've talked about PDSA forever. What's the first one? Do,
plan,
plan, do,
study, act.
Study, act. Oh my gosh. Thanks, folks. Don't get old. Don't turn 55. Your memory will never be the same. We get caught up in those PDSA cycles, but sometimes we don't draw things out, draw the process out. Some of those maps get crazy, but when we look at those processes, can we simplify? Are there too many steps? Are there not enough steps? Are we forgetting key players? We need to draw things out and then start looking at what our processes are and constantly be in that improvement process. And that's why sometimes implementation can take so long. But I think we can get stuff really narrowed down to a really great, a great flow within our own individual systems and make it work for our families. The next slide, please.
And I'll just pop in for 1 second and say the model for improvement is what UPIC uses. And so all of this, I had a big grin on my face as he was talking about how quality improvement dovetails in with the structure, processes, outcomes set up, because this is what we hear from UPIC regularly and we know it works. So
it sure does. And sometimes it's painful to look at things. It's easier just let it go than look at it. And I think sometimes we don't want that. Ooh, what are we going to find when we look at this stuff? Because sometimes being told things aren't perfect feels like a bit of a slap in the face, but we know things aren't perfect and we have to face that sometimes. Let's look at that next step.
Sorry, do you want me to continue?
Yeah, next. Okay. Sorry, if you go next slide, I apologize. Okay. Yep. And then describe where we are now. So do a needs assessment. What's in place? What are the criteria for transition? Let's look at the processes and who's responsible. And that's it in every organization. Who's responsible for making that healthcare transition happen? Or is anyone responsible for making that happen? And if not, who is the most logical person in your practice or in your organization for ensuring that that happens? And making sure they have the capacity or the bandwidth to take that on. And if not, what can be taken away from them to make sure that that happens? Let's look at the next slide. And let's keep moving. So this is the one, the 6 core elements, approach and timeline for youth transitioning from pediatric. So this is all on the Got Transition website, but they talk about appropriate ages for certain things to happen. You need to discuss and have a policy in your practice and discuss that early on with patients who are in that 12 to 14 age range. You need to track and monitor all of your patients who are within that transition age range to ensure that you're following up with them and providing ongoing guidance in that 14 to 18 year range. Assess readiness regularly and continuously with both parents and the patients in your practice. Are they able to do certain things? Are they able to fill their own prescriptions? Are they able to talk about their medications? Do they understand insurance? Things like that, and assess them and their families on a regular basis. Develop a healthcare transition plan and work on some of those areas where they're not proficient, areas that they can do, and talk about things like Eric mentioned, supported decision-making. With the provider, with the staff, figure out those areas that maybe the patient won't be able to do on their own. And a lot of those areas you can figure out by doing readiness assessments, which are part of the provider toolkit and on the GOT Transition website. And Stephanie Sund can provide any of you with the provider toolkit for your practice to help you with some of these tools. And then get ready for them to do that transfer of care. And it's a lot of work on the pediatric side of things to get that transfer ready, but communicate with the new provider, ensure that information is in bite-sized chunk that can go to that new provider, and then all of the follow-up that happens after that transition has been made to ensure that the patient got to the new provider, that there are no more questions, and be prepared to do things like continue to fill medications and consult with the patient and the new provider while that transition happens. So there are a lot of parts and pieces to this, but there's also a lot of help out there to help you make that happen. And I'm not going to take any more time on this because we have some other pieces we want to cover, but I just want you to know there are lots of tools out there, and many of us are willing to kind of help you look at some of these pieces. And these slides are available, and we want you to know that we're able to share those with you as well. And we can talk more with you if you'd like some one-on-one. So there's a lot of help out there to help make those things happen. I know Steph Sund is willing to help practice. We're willing to hop in and kind of help you kind of look and examine at where you are now and where you'd like to go and help guide through some of that process. And I'll stop there, but just know you can reach out to me with additional questions, and we're happy from the integrated services side of things to jump in and help you with that.
Excellent, thanks. Thank you, Eric. Well, I'll just make a quick note, and it'll come up at the end of these of the meeting slides as well, that one of the things that Dr. Hergenroder really emphasized over and over and over again was that you shouldn't create your own tools for the transition, healthcare transition process, that they exist. They really do exist. And in fact, his team at Texas Children's Hospital and Baylor College of Medicine created something, transition planning tool, TPT, I think it is, and it's integrated in their Epic system. So I'd like to find out if that's something that we could get in our University of Utah Epic system. But suffice it to say that even if it's not something that's integrated into your EMR, that there are tools out there already. That work has been done. There is no need to reinvent the wheel. And Stephanie and Chelsea Gina, who are part of the Intermountain group who head up the statewide initiative, have knowledge of where those things are and who is doing them. And in fact, we had a great set of folks reporting out on how they're doing in implementing transition in their clinics and areas. And so I'll talk about that in just a moment, but they've done these things, and we can take off from what they've done for sure. Thanks so much, Eric. And Chanel just put a link into the chat. This is the medical home portal page that does in fact have the Utah provider toolkit link on it. This is the Utah specific version of the GOT transition information that Stephanie and others have worked so hard on. So I want to make you aware that that's very available right there. All right. So Stephanie, I have just a couple of slides in here from the reports that the Primary Children's Outpatient Behavioral Health Clinic representatives did, and also the Utah Adult Congenital Heart Disease Program did. And if you want to just take a minute and talk about anything that you felt was the main takeaway with regard to those reports, please feel free. So I thought it was really interesting that we heard from, let me go back. We heard from Brandon Roper and Natalie Harris. And so they're part of Primary Children's outpatient behavioral health. And one of the things that I was really struck with, as I was just mentioning, is that they have come up with their own tracking sheet to organize and identify current clients who are transitioning. And their tracking sheet does all of this. So color-coded to identify current participation and completion of the transition workflow, dates, education, resources, follow-up calls, messages left, and any current complications or barriers. And so I was thinking, hey, maybe that's something that we could get a copy of if anybody's interested in it, because I thought that would be a fantastic tool. So I just wanted to make you aware of that. And then we also had a presentation from Dr. Ian Lindsay about what they're doing in the Utah Adult Congenital Heart Disease Program. And I must say, his slides were so nice. He made it look really easy. I know it's a lot harder than his slides made it look, but one of the things that I took away from that too, separate and aside from the processes and the efforts they were making around healthcare transition, was all the locations of the Utah Adult Congenital Heart Disease Program. And so I wanted to just pop those up here and make sure you guys are aware of that too. So they're really making inroads, not only in Salt Lake, but throughout other areas of Utah, in several areas in Idaho, and also even in Alaska. And so there was one other report out from Dr. Vanna Raman, who oversees the endocrine, pediatric endocrine program. And one of the things that I just got from all of these is that they are really using that readiness assessment that we mentioned before, pretty important. And they're all using a tracking tool. And in some cases, it's really quite integrated in the workflow, which I think is ideal if that's possible. And then there is an actual process that's expected to be followed for the staff. It's codified. And in several cases, it's an algorithm. It's pretty cool. So I wanted to share that with you. Stephanie, do you have anything you want to add? Oops.
I don't know. I think, so just so you guys know, the readiness assessment is huge, and we are trying to get more and more clinics to complete it. And it's getting put, it's actually a live document that we're able to enter into iCentra now. So that's really good. That's our EMR system we use at primaries and throughout Intermountain. And he really talked a lot about, we also got from Dr. Lindsay was something about called a portable medical summary. And that, talks a lot about what Eric had talked about with all the documents and having to try to get a chart from, the peds provider. These adult providers get, thousands of documents, and these kids are really complex. And so having a portable medical summary, Dr. Lindsay showed us one that Congenital Heart uses that has a diagram of their heart on it, because a lot of times their anatomy is so different, it's really hard for them to explain to a provider or to show what that looks like. So they have a tool in this portable medical summary they can use. And I've just heard that it's going really, really well. It's really helpful. It's really helpful for the teenager to see this and to just have it all in one place. It makes that handoff a lot easier. So that's another thing he did talk about that was really, really innovative. And then, yes, the tracking tool, Brandon did not recreate the wheel. He took this tool, he created it based on Got Transitions. Got Transition has all of the stuff laid out for you pretty much. The toolkit that we created has the tracking tool in it as well, just for an example. And then, yeah, the process is huge. So that's the one thing that we're trying to expand on is some of these clinics have been doing the work, but only, you know, 1 or 2 people are doing the work. So like behavioral health, Brandon has been the leader in all this, doing all the work. And so he's at the point where him and the clinic, they want to take it to the rest of the staff and have the rest of the staff start doing some of this, handing out a policy, talking the talk, being able to walk the walk with these families. So it's not just him doing it. And that's huge because that's what Dr. Hergenroder really talked about, is that structure, the processes in place, kind of taking a team effort. And so that was really good of Brandon to show that and kind of talk through that with his work. Otherwise, I don't know. Each group had a list of questions that they asked Dr. Hergenroder. He was able to kind of just asking about certain barriers, things that are coming across. And he was really able to, I think he was really able to help them a lot. I haven't gotten any feedback yet from the group of what they actually thought of it, but of the presenters, what they thought. But yeah, so I would say that's my takeaways from that. It was really good.
It was really good. And I think this is an excellent opportunity to show the toolkit. So let me pull that up and make sure everyone is aware of that. And I would love to hear our participants here today, our attendees here today, if you have anything you want to talk about with regard to implementing transition in your practice, in your role. And if you do, please speak up. That would be terrific.
And I will say, if it is something that you're interested in starting and you don't know where to start, that's absolutely something I can help you with. We have 8 pilot clinics right now that have been piloting the work for about 18 months now. And some of those clinics we started from the ground up. So I can absolutely help you take the steps necessary, help guide you. And this toolkit is not set in stone. This is our first version. I had a couple master's degree students work on it. And so if you go through it and you find, well, this is silly, why is this in here? Or this is really missing, or this could, be changed, please let me know. My contact's really easy. It's just my name, stephanie.sun@iml.org. So that's a really easy email to remember. And yeah, just contact me because we want to upgrade it. We want to change it. Even like this flow map, for instance, it shows kind of the flow throughout the clinic and what it should look like. And we're realizing now that it should be a different order. So it's still little things like that we're just tweaking and changing as we do the work. The guideline, if you wanted a policy, we changed the word to guideline instead of policy, just it's a little softer, we felt like. And so just like we could make you an individual one specifically for your clinic that has your names on it, your contacts, if there's specific contacts you have, we can change ages. Like the diabetes clinic, for instance, got transitions recommend starting at 12. They didn't think that was doable for them. So they're starting at 14, giving the policy out at 13 or 14 instead of 12, which we thought, that's totally acceptable. We'll take what we can get. Some of the stuff in here isn't super helpful. There's the registry, that's that tracking tool that's really good. But like the individual flow sheets, certain things like that, we don't document on paper anymore. And so it's not really that helpful. But like the readiness assessment that's here, that's, like I said, that will be in the EMR, and you'll be able to pull up the past 3 years of EMR readiness assessments. They're technically supposed to be done yearly, starting at age 14. So, but yeah, some clinics, are just barely getting their feet wet with this. So some clinics have been doing it really well, like cardiology. They have a readiness assessment that's specific for congenital heart. And he just got transitions and changed it a little. And then they have a way of entering it into something called REDCap, is what they are using as REDCap. So some of the processes aren't perfect, but we're starting and we're trying to get there. Some of the clinics, like I said, are way farther ahead and some aren't. And then with the, the general practitioner clinics, like FM clinics and that kind of stuff, honestly, we've hardly even touched. It's a little easier to get into the specialty clinics at primaries for whatever reason. So that's definitely something we want to start working more and more with the medical group. Mindy had mentioned my coworker, Chelsea, who just got hired in May. She is going to be helping us do a lot of that. We're hoping to really help get this work out even further into the community and not just within primary children. So.
Oh, that's terrific, Stephanie. And Eric Stoker says that he really wished this toolkit was around when he was doing his transition to adult healthcare. Yeah, Eric, you kind of had to go it alone a little bit, didn't you?
My mom had to help me a little bit on that, Mindy, because I think right as soon as we were transitioning, my mom and I both were trying to scramble and find stuff. But this toolkit was around when I was doing this. I think we would have been saved a lot.
I agree.
But I was looking at the questionnaire thing you were showing Mindy earlier. I think it's really cool because I think people with disabilities can understand what it is, and it's a good and explains things, and then they say like, I want to learn how to do this stuff, because this would be a really cool toolkit for self-advocates doing this. This would be cool.
Exactly. I think that's great. And one of the things that I wanted to emphasize, so Dr. Hergenroder showed us in the GOT transition toolkit, there are scorecards for each one of those 6 core elements, so that you can rate yourself. And of course, measuring how we're doing is the only way we know if we're making progress. So he showed some scorecards from his own divisions at Texas Children's Hospital, and some of them actually were kind of shocking to look at the scores and to look at the boxes, because they were blank. They had made the decision that they weren't even going to work on some of the areas because they wanted to focus on others. So they literally just stopped doing some parts of the transition process to focus and really do well on others. And his point was that it's whatever approach your clinic, your team has the resources to do, and they supported that. And so of course they've got quite a well fleshed out program going on there with a lot of supports, and we're working towards that clearly in Utah. But his point is that it's important not to compare ourselves with others, just to keep making progress within our own environment. All right, let me get back to our slides. So we were hoping to take a few minutes with you guys today and do a little breakout exercise, which was actually something done in the summit, and it was really interesting. We divided up into something like 6 different groups, both virtually and physically, and had a facilitator and had some case studies. And I'm afraid we don't have time to do that today, unfortunately. Stephanie, Eric, and I all were facilitators of one of those groups, so we were going to redo that here. But to do it well and to do it right, we need more time than we've got. So I'm afraid we're not going to be able to do that. But let me tell you some of the takeaways that I think came out of that exercise as well. And I thought I had them documented in here. Let me go back and see if nope, I didn't get them documented in here, but I remember they included starting early. So if we can start early with the readiness assessment and really whatever you're able to do, that's a takeaway for sure. The outcome, the result will be better starting earlier with these patients and their families. Another thing was to really get a relationship going with those adult providers that you want to transfer to. And I realize that sounds like shooting for the moon, right? But again, all of these things take time. So if we can start putting out some feelers now, then maybe in 5 years or whatever, those relationships will be solid. And for the young people who need to transition at that point in time, there'll be a much better structure in this case for that. And of course, the need is very well known. And so work is being done in Utah to try and help identify and find ways to have more of those adult providers. But that relationship is still really important. So I want to emphasize that if there's ways to communicate with adult providers that you're aware of and start to let them know who you are and what you're trying to do and let that percolate for them. I think that's really important. Ideally, we're getting to know them, we're seeing them, we're interacting with them regularly, and that's much harder than it sounds. But start that relationship process if you're able to at all. And then something that just, we know this, but we need to hear it again and again and again. And that is to meet that young person and that family where they are, mostly the young person, and to focus on their strengths, what they can do. And remember that this is about what they want as they transition into adulthood. It's not about what we want for them. So that's hard to do, but it's the most important thing. So, Eric, Stephanie, anything that you want to add?
I was just going to say, do you want me to email you I can email you the case studies if anyone's curious just to read over them, kind of what we created. And then we created a list of, I think each case study has 6 questions or something attached to it.
Yeah, I actually have all of those, Stephanie. So okay. Yeah, thank you. So that's a good point.
Well, and I was going to say too, maybe I was thinking the same thing. I think we're all in the same wavelength there. I was going to say maybe just by way of, not even homework assignment, but just kind of reading up on some of like the scenarios we discussed at the meeting. I think part of the conversation really was, we a lot of times focus very much on transition and, what's the process, doing a readiness assessment and all the rest of it, but we don't always often broach the topic of how do we even bring up transition, or how do we address those really tricky transition moments in the practice. The wide-eyed look of, oh, it just dawned on me that when my kid turns 18, I don't have the same parental rights, if you will, that I did up until my kid turned 18. So how do you finesse and address some of those more nuanced issues of transition? How do you bring up those conversations in a delicate, sensitive, but tactful way that helps parents and the youth involved realize what really is coming down the pipe, right, wrong, or indifferent, and how those things will change? And how do you tactfully and lovingly, if you will, prepare these families for what's coming? We look at somewhat often as this whole big process, and we talked earlier, and I certainly focused on, let's draw out the whole process, because if you don't have it drawn out, it can't happen. But we have a process because there are people involved. And how do we really deal with some of that human side of things? So I think some of these scenarios are really good looking at those pieces. How do you deal with the dueling conflict of parents who have nothing but the best interest at heart for their child, but also balancing in some independence for that child? And up to what level can those youth and young adults be, especially those with special healthcare needs and some intellectual disability, up to what level can they really function and make some decisions on their own and have a support team that can help them to do that? So I think these scenarios are really good to bring up some of those maybe aha moments that might not be aha moments just for the parents and the youth, but also aha moments for the practice of, oh, wow, those are some things we'll have to address. So I won't belabor this anymore, but these studies are really good for that purpose. It might just be some food for thought to get some discussion going in your practices for, ways to enhance your skill level to discuss these topics.
Yeah. Okay. Well, I will send those out as we do the meeting summary as well. We'll do that separately. And if people are interested in, potentially reviewing those, thinking about how they might be applicable to their own practices and their own situations, that would be great. Very good. All right. Well, these were the big takeaways. Takes a long time to get healthcare transition fully implemented, 5 to 7 years. even longer. Be prepared and don't get discouraged. And you can hear Stephanie talking about the Utah Provider Transition Toolkit, that they're going to keep updating it and improving it. She's doing her own PDSA cycles with that. It's just part of the process. It's just what we do. So this structure, processes, outcome model is important. And the emphasis that we kept hearing is that if the structural pieces aren't in place, the other stuff just can't come. Now, that doesn't mean that you're not supposed to still continue to be working on things as best you can, but the structure is critical. It is the foundation. And by structure, we mean, you know, having the bodies in place, having the systems in place, and of course that's sometimes out of your ability to do, but we're working on it, and hopefully you've got someone in your practice who can champion this and be aware of the structures within your environment that need to be working to best do transition. PDSA cycles, keep tweaking, and refer back to UPIC if you have questions on how to do that. Data, we gotta have that data. They emphasized numerators and denominators, so we can really see, you know, the percentage of patients get improving and getting these outcomes. So one of the things that one of the clinics is doing, or maybe multiple, I don't quite remember, but the idea is to look every month at the number of patients who are turning 18, and then understand what that is as a percentage of the overall patients in the practice, and use that to help guide the processes that need to happen to make sure they're getting transitioned correctly. And then, of course, lastly, don't create your own tracking tool. So if you're interested in trying to borrow somebody's that's already in place, let us know and we'll do our very best to connect you with that. All right, well, are there any questions, any thoughts that you'd like to share? We'd sure like to know if you're doing transition in your own area, and what your wins are and what your hurdles are. And you're always welcome to talk about that in our brainstorming section of these meetings, or
Mindy, I did forget to mention one thing. They just did release something about the new ICD-10 codes that are available for transition planning, and in conjunction with any sort of other diagnostic code that may go along with that visit. And yeah. I was a moment or two late getting on, and I don't know if you announced that on the front end or not. So
I didn't, and I saw an email last night about that. So thank you for reminding me, because I did want to mention it. I'll see if I can grab it quick. We'll of course include that. Oops.
Yes.
Sorry, yes. in the summary. But yes, there is a new ICD-10 code for counseling in the pediatric to adult transition process. So you can get paid for this. Is the bottom line. I can't find it. I'll find it and include it, because that's so important, right? We've got to have the resources to be able to do this work. So progress there.
And that's some terrific progress. We're excited about that.
Yeah. Well, I'm excited about next meeting as well. So our November meeting is going to be motivational interviewing. We've done this a number of times before. It is warmly welcomed by the group, and we've got some new folks who are going to help us out with it. We're really looking forward to this. And of course, motivational interviewing can be very helpful, I'm sure, in talking with your families as you're trying to help them with the transition process. So it's applicable in probably every area of our professional and personal lives, but it is very relevant to transition. And Amy has put in the chat, very good. So it's effective as of October 1st, this ICD-10 diagnosis code for pediatric to adult transition counseling. So that's fantastic. And yep. We'll make sure that goes out in the summary. Thank you, Amy. I appreciate that. All right, well, I think we're going to give everybody about 5 minutes back this morning. Thanks so much. Happy October. We're in the second half. I can't believe it. This year is almost over, guys. Pretty crazy. Happy Halloween. Don't forget to vote, and we'll see you in November. Thanks, everyone.
Thanks, Mindy. Thanks, everyone.